Welcome back to the third episode of Back to Bone, Orthopedic Legends Reimagined, the series where we dive into the lives of the pioneers who shaped modern orthopedic surgery. Today we introduce a true visionary, Dr. Gunter Küntscher, the man who revolutionized fracture treatment with intramedullary nailing. Welcome, Dr. Küntscher.
Thank you for having me. It is an honor to be part of Back to Bone, Orthopedic Legends Reimagined. Reflecting on my life's work and the evolution of intramedullary nailing brings great satisfaction. I look forward to sharing the journey of this technique from its inception to its global impact. Let us begin.
Dr. Küntscher, could you share with us the origins of your idea for intramedullary nailing? What inspired you to develop this technique, and what challenges did you face in its early conception?
The idea for marrow nailing, or intramedullary fixation, was born out of necessity and a desire to improve the treatment of long bone fractures. Before my work, fractures were primarily treated with external splints, traction, or cumbersome plating techniques, often leading to prolonged immobilization, muscle atrophy, and poor healing outcomes. I was particularly inspired by the natural structure of bamboo, which has a hollow yet strong internal structure. This observation led me to hypothesize that stabilizing fractures from within the bone, rather than externally, could offer superior mechanical support and faster healing. My early experiments, conducted in Kiel University Hospital in the 1930s, confirmed that inserting a solid metal rod into the medullary cavity provided immediate stability to fractured bones. In 1939, I performed the first successful intramedullary nailing on a patient at the University Department of Surgery in Kiel. The results were promising. Patients could bear weight much earlier compared to conventional methods. However, when I presented this innovation at the Surgical Congress in Berlin in 1940, my colleagues dismissed and ridiculed the concept.
We have an archival video from 1942 showing one of your surgical procedures on a tibial fracture. Could you tell us more about this operation and its significance?
Yes. This footage from 1942 represents a pivotal moment in the early application of intramedullary nailing. At that time, I was stationed at a German military hospital on the Eastern Front, where I had the opportunity to treat numerous soldiers with severe fracture, particularly of the tibia and femur. This procedure, as seen in the video, demonstrates the closed intramedullary nailing technique, where a hollow stainless steel rod was inserted into the medullary cavity of the tibia without the need for extensive surgical exposure of the fracture site. My goal was to reduce surgical trauma, accelerate healing, and allow early mobilization, which was critical for injured soldiers returning to duty. At the time, this technique was met with resistance from the surgical community, who were accustomed to traditional methods like plaster casting and traction. However, as shown in this operation, the stability provided by the marrow nail eliminated the need for external fixation and significantly reduced the recovery period. One of the key advancements visible in this film is the use of fluoroscopy, a technique that allowed me to guide the insertion of the nail with precision. This was revolutionary, as it enabled closed reduction and internal fixation without direct visualization of the fracture, reducing the risk of infection. This footage is a testament to the early days of what would become a standard procedure worldwide. What was once dismissed and criticized in 1940 had, by 1942, begun to prove its immense value in real clinical settings, especially in wartime medicine. Seeing this historical documentation reaffirms the impact that intramedullary fixation has had on modern orthopedics.
You introduced groundbreaking techniques that revolutionized fracture treatment. Is there a particular case or event that stands out to you? One that truly exemplifies the impact of your innovations or the challenges you faced in gaining acceptance for intramedullary nailing?
Yes. One particular case stands out vividly in my memory, the operation on Walter Pape in 1942. At the time, I was stationed at a military hospital in Lapland, Finland, where I treated both soldiers and civilians. Pape, a 33-year-old Finnish national, had suffered a severe tibial fracture from a traffic accident the year before. His injury had failed to heal properly, and amputation was being considered. Determined to save his leg, I decided to apply my intramedullary nailing technique, even though it was still met with skepticism. Using a hollow stainless steel rod, I inserted the nail through the proximal tibia, stabilizing the fracture without exposing the site surgically. This minimized trauma and reduced infection risk, which was a significant concern during wartime. The results were remarkable. Pape recovered quickly, avoiding amputation and regaining full function of his leg. This case reinforced my belief that early mobilization and internal stability were superior to prolonged immobilization with external fixation. Interestingly, it was cases like Pape's that first caught the attention of Allied surgeons. Some prisoners of war returned home with marrow nails in place, sparking curiosity among Western orthopedic communities. This eventually led to the global recognition of intramedullary nailing, despite its initial rejection. This episode is a personal reminder of why I pursued this method, to offer better, faster healing and improve patients' lives, even in the harshest conditions of war.
What are your thoughts on the current intramedullary fixation systems?
The evolution of intramedullary nailing has been extraordinary, and I am pleased to see how far the technique has advanced since I first introduced it. When I initially presented my method at the 1940 Surgical Congress in Berlin, it was met with skepticism and outright dismissal. However, after Allied prisoners of war returned home with my intramedullary nails in place, British and American surgeons began to recognize the undeniable advantages of this approach. Today's intramedullary nails incorporate remarkable innovations. Coated nails, for example, use antibiotic or antiseptic coatings to reduce infection risks, a challenge I often encountered in my time. Furthermore, growth factor-coated nails aim to stimulate bone healing, addressing issues like delayed unions and non-unions, which were difficult to treat decades ago. One of the most interesting developments is expandable nail, which eliminate the need for interlocking screws and reaming, allowing for shorter surgical times and reduced radiation exposure for both surgeons and patients. Additionally, carbon fiber reinforced nails provide better biomechanical properties and radiolucency, enabling surgeons to monitor healing without imaging artifacts. I am gratified to see how my initial concept of stabilizing fractures from within the bone has evolved into a field that continues to push the boundaries of orthopedic excellence.
Dr. Küntscher, it has been an absolute honor to have you with us today.
Thank you for this opportunity to reflect on my journey. Innovation is never easy. It often faces resistance before it is embraced. But if it is rooted in the pursuit of better patient care, it will eventually stand the test of time.
With that, we conclude this episode of Back to Bone, Orthopedic Legends Reimagined. Thank you for joining us, and stay tuned for our next episode, where we will interview a surgeon who laid the foundations for a hip approach that, even after 100 years, remains remarkably modern.